Right there, yeah?
Yeah.
And breathe in. And breathe out. Perfect. Good. Breathe in. And breathe out. Good stuff. So, we're going to press onto this rib again. Nice. Good. Perfect. Let's go on your side facing me.
I just feel like it's already tight right now.
Yeah, I'll loosen it up for you, not a problem. Right here, right here. A little bit of twist, alright? Perfect. Let's go the other side. Bend this top leg for me. Good. Let's switch you to elbow garden range right there. Good. A little bit of twist towards me. Perfect. Cross the arms right here. Breathe in for me. And breathe out. Good. One more. Breathe in. And breathe out. There we go. That's what we're looking for. Good. So, what we're going to do is go ahead and lift that head up. Do a little bit of soft tissue on the SCM. So, lay your head back. Turn your head to the right for me. Feel this muscle right here. Mm-hmm. So, we're going to loosen that up. This is just going to be some manual therapy. But, let me know if it's too much, okay? Feel this here.
That's really tight.
Yeah. So, when you were having that rib issue, you were probably doing a lot of chest breathing thereafter, right?
Yeah.
So you're utilizing your accessory breathing muscles up here. And so it's like an asthma attack. Afterwards, you'd be very sore and have some tightness that you wouldn't normally have.
I feel like a heart attack.
Yeah, it's not fun when you have a rib just stabbing right through the chest like that. You said you called your cousin?
Yeah. And he wants to feel it. Wow. Like my forehead.
This one? Yeah. So.
It's like all like numb, you know.
Yeah.
All my whole like body like feels it.
Yeah.
It's so weird.
So the SCM runs here to here, but its referral pattern is all the way up into this eye and even a little bit across the forehead.
Yeah.
So
weird.
it's a good thing we're getting it out, because if you continue to kind of let this go, you'll develop tension type headaches right through that area as well. So I do this a lot for my headache patients. Good. And we'll go right into this. Feel this here? So after this, I'll show you what these muscles look like when they're overworked, because they're not pretty.
It's like it hurts but it tickles.
Yeah. Yeah, and then even a little bit of chest, which we had already done. Good. Now I would suggest that you very gently ice this stuff, just a few minutes at a time to get rid of some of the inflammation.
Okay.
And then we're going to do some ice and some electrical stim for you after this, okay? Good. All right, go ahead and sit up for me.
Okay.
Move the neck around a little bit. How's that feeling?
Looser.
Looser?
Yeah.
Good. So that side's definitely going to be improved. What I want you to do now is take your fingers and point them this way and just look up just a little bit here. So if you're feeling any tightness through this mid-back, very gently rotate side to side. But basically, once this rib has had an event like this, it's prone to doing it again. So you have to give the muscle the opportunity to reset, hence why we did the intercostal muscles. Feel that?
Yeah, I just don't want to go through that again. Sucks.
Yeah, it's pretty horrible. So we're going to do like over here. The good news is now that you know what it is, you won't have the panic associated with it. You'll be able to fix it a lot easier.
Right here hurts too.
Yeah.
And I'm like, what's going on with me?
When you lay on your side?
Yeah, you know, your own fetal position.
Yeah, you might not want to do that right now.
Yeah.
Try to sleep on the right side a little bit. Okay?
Okay.
Nothing wrong with sleeping on your side, but if you're right on top of your shoulder, that's when you're going to run into issues. So slide that arm out and rest your head appropriately right here.
Oh, like this?
Yep, so you'll actually want to bring your head up so you're neutral. So, lay on your side real quick, I'll show you. It's too low. See how your head is sinking down? So bring this head up a little bit. So your head, will it come down? Rest. Your head should be right here. Okay, see how it's net neutral?
Mm.
But it should be relaxed on your pillow, net neutral.
But yeah, sometimes I don't like sitting with pillows.
Okay, well that's gotta
Yeah,
stop,
I know.
okay? Because that'll make the neck real tight. If you sit like
Maybe
this
that's
for
what
8 hours, imagine how bad it would be. Now lay down in gravity, you're doing the same thing.
Okay.
This time, just because we just worked on that neck, okay?
Okay.
But I'll definitely do it here. So what I want you to do,
Right.
feel this nice little tension here. We're gonna do a little extra pull. So take a deep breath in your stomach. See how that was chest? That's something we're gonna work on.
Oh.
And breathe out. And then close that mouth. Perfect. That was great. I moved everything.
Yeah.
Good.
Wait, but I didn't breathe through my stomach, I breathed through my chest?
Yeah, we'll work on it, okay?
Okay.
Because that would be important too.
Okay.
Okay. There we go. So, this is going to be a little bit different of a stimulus, okay? So,
Okay.
it's going to be semi-challenging the abs while we're breathing into them. So, stick your arms straight out in front of you. Good. And I'm going to put them right here, okay? Now I want you to bring these knees up and place the heels right there. Same thing right there. Okay, from here, see how there's a little arch in the back here? What I want you to do is rotate your pelvis like this so that the back is flat against the ground. I don't want you to put any weight in your feet. They're just there as a rest, okay?
Okay.
So you're using your abs to pull your spine to the ground. Feel that?
Okay.
From here, I want you to breathe into my fingers right here. So see how that came up in the chest
Yeah,
there?
like, how do I do this?
So that's part of the reason this rib is getting irritated. We're chest breathing too often. So let this relax just a little. Okay? Keep that back on the ground. Breathe.
But I feel like I arch my back a lot.
Yeah, and that's why we're in
Especially,
this
like,
position right here.
Especially
It's
like
'cause
when I
it'll
do
help.
sit-ups, so
Yeah,
I feel
that'll
like,
work.
okay.
You ready? So breathe into this. See how
Am I
difficult that is?
Am I
Alright,
doing
so
it?
I'll give you 2 stimuli right here. Okay? So what you want to do is push the stomach into my fingers.
Okay, I'm ugly.
So here, look at my stomach right here. So this is sucked in,
Okay.
this is pushed out. Yeah, that was great. All right, let your belly button go all the way to your spine real quick.
Okay.
So just relax it and go all the way to your spine. Good. Now take a deep breath into here. So you breathed out and did it well. I want you to breathe into it. That's a lot better. So you're basically pulling the air here and dragging it down here without it going into your chest.
Okay.
Okay? So try that out. That was out. So have you lifted weights before?
I mean, yeah, but because it's been a while.
So when you're doing that, basically the goal is to create a large abdomen here as a base of stabilization. Okay? So take a deep breath in here. It's a little bit better. See how it starts to come up in the chest though?
Yeah.
Just try to get it down here. Nice, it's a little bit better. Let's try again, right into this finger. So now without breathing, just push your finger into my stomach. So push the stomach out. Nice. It's a little bit better. And then while you're pushing out, I want you to pull that air down into it.
Oh, I can't.
I know, it's tough. All right,
What
sit
is
up
this?
for me
What's
and we'll
wrong
try
with
it. So sit up for me and we'll try it seated, okay? It's a little bit harder to gravity for some people, but
I feel like this is like what people say when you try to sit, right?
correct. That's one. Well, they diaphragm. We want it all the way down to the stomach.
Okay.
Okay? So I'll pull this back so you can even look, okay? So take a deep breath into my finger here. Better, breathe out and breathe in.
So you almost like,
Good. That was good. Very good. Do that again.
really?
Yeah, good job. Perfect. You see how that's coming down to the stomach like that?
Yeah.
With practice, you're going to be able to do deeper breaths, draw it in, and create a cylinder, essentially.
Okay.
Okay? That cylinder is supportive for your low back. But in your case, which is usually what I use for like disc herniations and low back pain, we use abdominal bracing as a support mechanism. Like you've seen people at the gym with like belts.
Yeah.
It's using your abs similar to that.
Okay.
Okay?
I thought that was also just like to help the lower back, like so they wouldn't
It's the
hurt
same.
a disc or something.
Exactly. So it's one and the same there. Basically, when you put a belt on, you're doing your abs twice over. Okay? So if you work on doing that, it'll also stop the heaving of the chest and allow that rib to reset a little bit and get less irritated. Okay? Yeah. So remind me next time when we work on this
Should
again.
I go buy a belt?
No, not at all. Don't worry about that. Just work on belly breathing throughout the day.
So like in yoga and meditation.
Exactly. Yeah, so that's really the only place people have that skill set right now is yoga. But when you can come here and then go. See how my chest doesn't move at all? That's what makes it difficult. You're doing better already. So just practice that.
Okay.
Okay?
Practice.
Cool.
All right.
All right. So let's meet you on stage.
Okay.